Okay, so here is the summary. On this column here, we have the type of bleed: extradural, subdural, subarachnoid. And for each of these three bleeds that we've been looking at, we're going to answer the questions: arterial or venous, the typical age group, risk factors, CT findings, and treatment options. So, quick fire now. Okay, so extradural, arterial or venous? Well, we found that these were arterial. The typical age group is usually young men. The risk factors: well, trauma, sporting accidents, car accidents. It's usually 90% of them associated with a fracture. What do you find on CT? Well, we find a lens shape hyperdensity because it's fresh blood. Okay, oh, there we are. Something like this, a lens shape hyperdensity. And the treatment options, well, it's going to be craniotomy or a burr hole. These patients can deteriorate rapidly. Okay, a subdural. Arterial or venous? Well, these are typically venous. The age group? Well, these are typically older people, elderly usually. The risk factors: being old and alcoholism and anticoagulation, of course. There we are. Okay, the CT findings in subdural? Well, it's going to be a crescent shape, and it's going to be hyper or hypodense depending on whether it's old or new blood, whether it's a chronic or an acute subdural haematoma. And there we are, crescent shaped. And the treatment options for this one, or it can be conservative, or can be a craniotomy, can evacuate the haematoma. Subarachnoid, arterial or venous? Well, these are arterial. The typical age group: not young, not elderly, but the mean age of 50. The risk factors include smoking, hypertension, polycystic kidney disease, and berry aneurysms, and arteriovenous malformations as well. And the CT findings, well, I haven't really got a little graphic for this one because it's a diffuse hyperdensity throughout the arachnoid, the subarachnoid space. The treatment options for these, well, these are either clipped or coiled. Okay, if you can remember this table, if you can recall that on the spot, you're able to understand a lot of the basics about these three types of bleeds. So that brings us to the end. It's October 2014. Thanks for watching this video presentation on intracranial bleeds. I've been Phil Brown, and I wish you all the best in your exams, in your vivas, in your OSCEs, and I hope you feel confident knowing a little more about the basics of intracranial bleeds. Okay, bye bye.